Good afternoon. Actually, it's an honor. Thank you so much, Mr. Daniel, and thank you, Dr. Suad, my mentor and coach and kafil. I'm just kidding, kafil. That was a joke. طيب, I have the pleasure to actually be with you today. I wouldn't realize the miracle that I've lived through. When my parents came to Abu Dhabi, I was -6. I wasn't even born, right? It was 1972. So the healthcare system has gone through a huge transformation. And in my 43 years, I mean, I've never seen an amazing transformation happening in any other country but this beautiful, wonderful nation of UAE, led by the leadership. So what I will tell you today, build on top of what Dr. Suad has said in terms of the change and the actual disruption that has happened, where government agencies and authorities and ministries started talking to each other, led by our leadership in the UAE. So I'm going to cover a bit of the technology that was essential for us to fight this pandemic and show the world that how resilient this nation is in all the different sectors. The fact that my kids went back to school in person within three months was a miracle, because I could not bear my kids, by the way. 8 years and 5 years, not doing long-term or what do you call it, distant learning is another challenge. But anyway, so the fact that we had distant learning and internet connection, uninterrupted internet connection that made us survive during this pandemic is phenomenal. Anyways, so let me start with a bit of introduction. And then I'm going to jump into the healthcare system in the UAE. I'm going to give a bit of overview. For those who don't know me, I've been in the digital health space for the last 22 years. And I worked in the UAE specifically in multiple capacities, from Cerner to Saha to PwC to DHA, covering a number of areas with huge focus on the UAE healthcare system. And then I'm going to end up with conclusions. So I'll try. I don't have my mobile. I just need you to time me, 20 minutes hopefully, so I don't go beyond that. But the area is, we've been doing a lot of strategy work in the UAE with Department of Health, the Dubai Health Authority, the Ministry of Health and Prevention. And the themes that have been coming up in the last year or two has been always rotating around genomics, personalized medicine, the use of AI, data science. These are the tools, and these are the themes. The themes is always about, for example, wholesome lifestyle, personalized well-being. It was talking about human 2.0, the use of bionics. They talk about space medicine, since it was the first nation in the Arab world that has gone to Mars. Last year, the mission of hope, or hope mission. The biggest headaches, there's a lot of mathematics here. The health economics, the expenditure in healthcare. In Dubai, we spend over 20 billion dirham a year. Abu Dhabi, we spend another maybe 30 to 40 billion dirham a year on healthcare expenditure. Okay? We're talking about huge sums of expenditure in healthcare, and it's ever rising. So we are always thinking about, how do we control this rising expenditure? We're talking about the health experience, the digital health experience, or the user health experience, or the patient health experience. Okay, so these are some recurring themes we've been noticing across the region. And when we benchmark UAE to Qatar and Saudi, just to understand the themes, to understand what is moving our healthcare systems in GCC. We look at, for example, the demographics with a high transient population. Because of COVID, now a lot of the immigration laws are changing. Seek for talent, skilled workforce is become a necessity, especially in healthcare. Patient experience, and how do we actually use the brand? Yani, for example, if you're a passenger and you flew in, like me today, using, for example, Etihad or Emirates Airlines, you get a very world-class experience in economy, okay? How about our patients? For example, Cleveland Clinic Abu Dhabi and the great work they are doing as caregivers and how we are revolutionizing the patient experience. The growing private sector, Mayo Clinic partnering with the Department of with Saha to run, for example, the Sheikh Shakhbout Medical City, and the great collaboration and science that is coming up. Medical tourism, and how can the UAE become the hub for hope and science and research. Care anywhere, how can we connect? And you've heard of the program called Malaffi, which is again a miracle that has become a reality. Malaffi is basically what we call the Abu Dhabi Health Information Exchange. 100% connectivity between the private sector and the public sector in the Emirate of Abu Dhabi. That includes over 50 hospitals in the Emirate of Abu Dhabi, almost 700 to 1,000 plus clinics and whatnot. Complete connectivity, which is the first of its kind in this part of the world. There was a huge race for this. And wellness. And you've just heard a couple of maybe months ago, His Highness announcing the UAE wellness strategy. Again, this is another byproduct of the COVID era. So, digital has become a very important part of our healthcare system because of the need to use the tool to provide healthcare services, to guarantee healthcare outcomes. We look at, for example, all the possible areas in digital health, from consumer mobile apps. One of the other miracles I'm going to share with you is Al-Husn, which has become part of life now. To look at your vaccination certification, it tracks your PCR across the whole nation across the whole nation. So again, very important ideas that are becoming realities. Telemedicine and the concept of virtual health, specifically in an emirate like Abu Dhabi, where it's very vast in its size. And you look at rural health and areas like the Western region, Ghayathi, and those areas, Jabal al-Dhanna, to provide specialized care. So anyways, the leadership is the secret. Always it comes with the leadership. When the pandemic started, the leadership promised and they delivered. And it all brought the main principles together. Working together, teamwork is the heart of the success of this nation from its inception. So when the UAE has embarked on focusing on the human side, because the most important wealth of any nation, it's humans. So again, the leadership started building the infrastructure a while back, before the pandemic. That's why the preparation began since the days of inception, building the infrastructure, thinking about disrupting healthcare and whatnot. So the leadership buy-in is one of the main secrets of success during the pandemic. Because when you look at healthcare system, it's so complex. Trying to put together some sort of connection between the different healthcare stakeholders. And not only are you talking about healthcare internal stakeholders, now we are talking about aviation, hospitality. They are now coming in. And by the way, one of the biggest lifelines that private sector hospitals managed to utilize during COVID is forming relationships and partnerships with hospitality facilities. So for example, they could expand the hospital capacity in less than 4 weeks in partnering with hotels. So your bed capacity was perhaps, before COVID, you're running your bed occupancy at 60%. With partnership with the hotel, when you have the pandemic, you could actually expand your doubling up or tripling up to try and accommodate isolation, quarantining facilities. That was one of the secrets that COVID has unlocked, how healthcare is engraved and integrated with other industries, hospitality, aviation, transportation, logistics. So again, the beauty of the healthcare ecosystem has expanded further to include bigger players, more players to come in. Okay, so the idea is when you have COVID, you started thinking about cost effectiveness, right? You're looking at every dirham going out and every dirham coming in, especially in the healthcare. You're looking at universal health coverage. Who's going to pay for quarantining COVID positive cases? Who are we going to get? How are we going to pay for PCRs? There is a whole new thought line or thought direction that has come up with COVID. The importance of digitization and how important to actually digitize further. And then services and regulation. So this is a very important page because if you look at the region around us, a number of projects, and again, there is a number of acronyms here that I can explain to you, but these acronyms or these projects show the importance of investment in healthcare, from universal health coverage in Egypt to building hospital information system and claims platform in Jordan, to putting infrastructure in Saudi for claims platform, for putting a digital blueprint in the vision of Saudi Arabia. And UAE is leading the way in a lot of these projects in the healthcare infrastructure. Even India is embarking upon a huge project to cover over 500 million people with universal health coverage. And because of the pandemic, that has been accelerated. Looking at the success stories in Abu Dhabi, in Dubai, in the Northern Emirates, and how we are actually putting together a successful digital ecosystem in healthcare is basically the secret of the success of the nation and what this nation is trying to export to our neighboring countries. Okay, so let's do a quick overview, just comparing how healthcare complexity looks at when you compare Saudi, Qatar, and UAE, where you look at, for example, in the healthcare system, the complexity of healthcare, the policy making. And COVID has come to help us manage the healthcare challenges in a centralized fashion. So prior to COVID, there was a decentralized approach. After COVID, as Dr. Suad said, there has been a lot of collaborative effort to centralize, the centralization of the decision making has become a success story for policy making. But then at the same time, you have the digital infrastructure that has been pushed in the UAE to lead the way across its neighbors. For example, the health information exchange and the claims post office platforms that has been implemented for the last 8 to 10 years in Abu Dhabi and Dubai to showcase the importance of collecting data. The partners and the vendors that we've been working with to actually implement. My first project in Abu Dhabi was with Sahha back in 2006 to digitize the Tawam hospital using an implementation or a health hospital information system called Cerner Millennium. The importance of federal laws, specifically in the health data management. How do you regulate data? How do you actually manage data when you have so much digitization happening in healthcare? And finally, the vision of the leadership. The vision from the strategic perspective to digitize, but also make sense, your public health policy, your wellness strategy, and whatnot. So, let's deep dive into the 7 Emirates and the 3 health zones. Always start with the leadership vision. The important aspects of COVID-19 is the amount of investment that the leadership put in to activate and revitalize the private sector, the strategies that are coming in to try and bring more digital, more innovation, more tools and frameworks to help you move and disrupt your healthcare ecosystem, and the latest news about the Virtual Asset Regulation Authority that was announced by His Highness, Sheikh Mohammed bin Rashid, to try and also see how we can uncover the cryptocurrency world and bring some of that into, perhaps, into other industries, such as healthcare. So, don't forget, COVID has hit us hard. However, the recovery was absolutely spot on. And that's why when you look at the PPP coming out of COVID-19, the private-public partnerships. Department of Health Abu Dhabi has led the way with signing a lot of collaborative agreements with the pharma companies to try and enrich and convert the consumption economy into production. And that's why you'll see the Department of Health, Abu Dhabi Investment Authority is working hard to try and put in the essence and the principles of research to try and sustain and make it a sustainable economy. Obviously, when you are looking at payments and reimbursement within healthcare, you look at what are some of the new trends using new methodologies to pay for healthcare. So again, one of the biggest headaches, because don't forget, healthcare expenditure in the UAE between 2017 to 2020 grew to $21 billion across the whole UAE. And this is a huge growth in terms of expenditure. Medical tourism across the world has grown to $708 billion, medical tourism. And this is the data that comes out of 2020. How much of that can the UAE play in as well? Because again, we have the brand, we have the infrastructure, and now we have the capability with the research capability as well to continue enhancing our offerings. So just the quick overview of some of the messages that came out of the biggest healthcare gathering in the globe, Arab Health, that happened back in January, January 24th, I believe, for 5 days. This conference is the biggest conference from a perspective of attendees and the perspective of deals signed. In previous years, in 2020 specifically, they've reached around $1 billion of deals signed during the conference period, over 70 to 80,000 attendees. This year, we've actually reached a good recovery level of around 48 to 55,000 attendees and a huge number of deals that got signed. The most catchy deals is basically key projects like the Department of Health working with huge healthcare accelerators, looking at partners to build chronic disease registries, also working with a number of players in the local market and the international market to formulate a proposition that is worth investing in. So tackling issues like obesity, tackling issues like heart disease and whatnot. And the idea is by having one of the most prominent examples of achievements in the Emirate of Abu Dhabi is the creation of the largest integrated healthcare system by combining and building a collaborative framework by major UAE players in healthcare to try and run and optimize and enhance the capabilities of a system, of a health system that has been growing immensely. And that's why I just wanted to show this, the digital aspect of the infrastructure that was built in to create this example and then export it to highly populated countries such as Egypt, Pakistan, or Ethiopia in the neighboring sphere. And that's why the presence of this conference in Abu Dhabi as the leading health system is very critical. Okay, so again, important leadership projects, always staying ahead, publishing strategies, going into the well-being, trying to also look at the major 50 projects that will take us to our centennial celebration, our 100 years of celebration. It's very important to understand where are the next digital frontiers that we will be exploring in the UAE. Behavioral health and mental health and how we can actually digitize and use the research capabilities that has been built with the investment, the huge amounts of investment that has been put by Abu Dhabi Investment Authority and the other authorities and ministries. Looking at, obviously, operating rooms. One of the biggest lessons learned from COVID-19 when private sector and public sector hospital lost their biggest revenue-making machines. How do we digitize? How we can actually diversify hospital revenue? And lessons learned from Mediclinics, Sheikh Khalifa Medical City, SSMCs of the world. How do you utilize digitization and health or virtual health to try and recuperate from obviously the hit that was the result of COVID-19. Look at imaging, and one of the biggest projects that being embarked upon in Abu Dhabi is to try, from Abu Dhabi across the UAE, is to try and unify your digital imaging picture archiving repository. And then some rising tech areas in healthcare, femtech, vet tech, insure tech, and how is this going to disrupt your healthcare system? And there's a lot of work happening as we speak in Abu Dhabi. Plug and Play is leading it with partners like Department of Health, Abu Dhabi Investment Authority, Saha, and other non-conventional partners. Itisalat, the telco companies coming in, Pure Health, G42, and again, disrupting from in outwards, right? By the way, one of the major strategies of our leadership is to create 10 unicorns in the next 8 years. So very important. What is a unicorn? It's a startup worth more than $1 billion. I just spoke to my Estonian delegations that I was meeting with yesterday, and they've just had their 6th unicorn. A country, 1.3 million, called Estonia, has created 6 unicorns. Very interesting. Okay, so very important developments that has made us more resilient in the healthcare system, specifically in the laws, the policies that we have. We've gone into hyper legislation mode when COVID started. Over 180 policies in healthcare that was established in less than 18 months. That is a miracle. That's what we call hyper legislation. Everybody talks about hyper automation, but nobody thought that one day we will have the same term used for your regulatory aspect. In conclusion, there was a very interesting publication that came out. It's called the Riyadh Declaration. A number of countries got together in August 2020, and they said, listen, what should we focus on to tackle and become more resilient? And they've highlighted 7 priorities. And by the way, these are great indicators and measures on how the health system is being disrupted across nations, and we can utilize this also to look at how the UAE has been doing in terms of the innovation in the healthcare system. From interoperability to actually the creation of health intelligence. And in Department of Health Abu Dhabi, they have already created something called the decision science. Not data science no longer, it's called decision science. There is a number of intelligent elements into that has been created and utilized to try and harvest all the data that has been collected. There was an initiative during COVID with the Abu Dhabi Public Health Center, NYU, and Khalifa University to try and look at all the data that has been accumulated from the PCR tests, the COVID tests, and try and build models to forecast where would the pandemic or where would the outbreak take us. AI, and it's become a huge need for AI. We have the Sheikh Mohammed bin Zayed AI University that has gone into 5th gear with all the data that has been accumulated during this pandemic. Research, and that's why the UAE is transitioning from a consumption-based economy to a production-based economy. And they are predicting now the next startup migration, instead of actually bringing it from the US or Netherlands or Europe into the Middle East. The idea is to try and bring the startup immigration from the UAE, from this part of the world outwards. And there are some good examples. The acquisition of Souq.com, the IPOs that have been now registered, like DIWA is going IPO, Moro is going. These are household names from the UAE that are going international. And then looking at governance and regulation, and finally the important aspect of public health and public health communication. One of the most important realization and achievement. How do you manage misinformation, right? The concepts of the misinformation has become one of the biggest issues in this pandemic? How do you actually inform, and rightfully so, inform your public? Okay. Okay. Some of the opportunities that we've seen also coming out in the healthcare sector, specifically in trying to automate the patient journey, and how do we actually use more virtual health. Some of the key questions on using private-public partnership to build sustainable healthcare systems. Are we gonna be constructing hospitals like in the same pace like we used to do? Do we need physical care anymore? What about virtual care? And what sort of accountability and transparency laws and solutions do we need, specifically in the area of patient consent? And so on and so forth. So trying to rethink and re-image as you deliver is one of the most exciting stages of this wonderful journey. And the idea is you're trying to reach the nirvana, value-based care, where you're always going to look at outcome-driven, patient-centric results. A lot of the words that you will hear in these days is around health equity. How do you provide equitable care to all people who are using personalized medicine, genomics, right? And offer a population health management solution, look at the power of quantum computing and edge computing. And by the way, there's a lot of investment in these areas. Quantum computing, advanced, and so there's virtual reality and there's extended reality. And now there's a lot of talk about metaverse and hyperconnectivity. So the idea is to go back to normal. Remember this picture? This is Arab Health back in 2020 or 2019. And that's why we're back again. If you go now to Expo, literally these images is there, right? Because of the leadership, because of the vision, because of the talk less, do more. Thank you.